Soldiers taking care of seniors. It's happening all over Quebec now and parts of Ontario. They're filling the gaps left by hundreds of staff who aren't working anymore because they've tested positive or are too afraid of the risk. And now hospitals in Quebec are starting to see COVID-19 spread within their wards. As Mike Armstrong reports, some say it's a time bomb waiting to go off.
With just about every day that passes, this Montreal Cancer Centre changes its practices, reacting to the threat of COVID-19. Cancer patients showing up for treatment have their own door. They're also called the day before and pre-screened. They're asked if they have symptoms of COVID-19. That said, some nervous their treatment could be put off don't tell the truth.
In one case, someone was COVID positive and came in there, and so the nurses had to leave and be quarantined and be tested.
More and more hospitals are dealing with outbreaks, and they seem to be hitting the most vulnerable. At this hospital, there were outbreaks in both the oncology and dialysis wards. 34 outpatients only showing up for treatments instead caught COVID-19 from patients in the institution.
They were trying to keep that isolated, but it's almost impossible.
There is a case in Montreal of a man who was staying at this hospital to have his medication changed. His daughter says he instead contracted and died from COVID-19. She says she was reassured there was no danger. The coronavirus cases were on a different floor. Now, the other impact of the virus is on healthcare workers themselves. More and more are off the job. In Quebec, the Premier says about 4,000 have tested positive, but another 5,500 are off as a precaution or even over anxiety or burnout.
Unfortunately, the situation is getting worse and worse because today we have 800 people more missing.
Some long-term care facilities are without 50 to 70% of their staff. In some cases, it's not COVID-19 sending seniors to emergency rooms, it's that staff can't keep up with basic needs like food and water.
They didn't have fever, they weren't having breathing difficulties, but they were sick because they were dehydrated.
Now, 5 military medical teams hit the ground earlier this week, but that was a drop in the bucket. Well, Ottawa agreed Thursday to send 1,000 soldiers in Quebec long-term care facilities. They won't be trained going in, but the extra hands are desperately needed. Mike Armstrong, Global News, Montreal.
Lots of people across the country were watching the Premier of Saskatchewan closely today. Scott Moe laid out the most comprehensive plan yet for gradually lifting some restrictions on our lives. It applies only to Saskatchewan, and it won't get life back to normal, but instead to a new normal. As Eric Sorensen explains, it paints a picture of what life for all of us could look like one day.
Saskatchewan is ready to blaze a trail slowly to get its economy and life moving again. Starting in early May, all medical services will be available, including dentistry. Fishing can start and boat launches used. In mid-May, golf, but with restrictions. For example, new precautions such as an elevated cup. The ball just hits the hole, no hands going down into the cup. Starting May 19th, some retailers can open. They include clothing, shoes, flowers, sporting goods. And some personal services can open, like hairdressers, barbers, registered massage therapists. So no date yet for restaurants, bars, fitness facilities, and childcare. Much later still, indoor and outdoor recreation and entertainment facilities. In all cases, gatherings of no more than 10 people, all the while trying to limit the spread of COVID-19.
We have to find the middle ground that continues to keep our case numbers low and keep Saskatchewan people safe, while at the same time allowing for businesses to reopen and Saskatchewan people to get back to work.
How can Saskatchewan do it? Its outbreak is relatively under control.
Saskatchewan saw its first case in early March, but there was never a big surge. There were 30 cases on March 28th, but then down from there, in fact, just single digits over the last 2 weeks.
When will other provinces reopen? Saskatchewan's plan now out. Quebec, Manitoba, and Alberta say they'll have an update on their plans by next week. New Brunswick and PEI have plans in the works, they say. And for Ontario and BC, so far, they say no changes before sometime in May, a time frame that likely applies to all provinces. The plan recognizes the economy can't stand still forever. Health experts see the need for balance.
There needs to be a real tug of war between slowing the spread of the virus down, but obviously not being able to eliminate the spread, but at the same time being able to open up some of our industries so that we can start to function again.
Saskatchewan's is the first detailed plan Others are watching. Eric Sorensen, Global News.
There's so much information surrounding coronavirus out there now. We know you have questions. Email your questions at globalnews.ca. Tune in to Global National or go to globalnews.ca/coronavirus now to find the answers.